Thank you very much, Todd. We now know an enlarged heart and blocked arteries led to the death of popular radio host Kidd Kraddick.
Also, reportedly, he was a heavy smoker for years. The 53-year-old Kraddick collapsed and died Saturday while at a charity golf tournament near New Orleans. The coroner in Louisiana says 3 of his coronary arteries were seriously blocked. Dr. Benjamin Levine is with us. He is a cardiologist.
Director of the Institute for Exercise and Environmental Medicine at UT Southwestern and Texas Health Resources. Thank you for being here. I think the thing that's surprising to a lot of people is that there are reports that he was a chain smoker, and I guess he was never photographed. It was something he hid, that's what reports say at least, because he didn't want kids to know that he was smoking. He didn't want to affect them. When you hear that he was a chain smoker, does this make sense now that he would have this much trouble with his heart?
Well, there are a few things that are worse for the heart than smoking, and both for men and for women. I mean, there's nothing that can turn a young woman into an old man like cigarette smoking, and it's the best way to acquire that risk. Cigarette smoking, having high cholesterol, diabetes, high blood pressure, those are the known risk factors. Physical inactivity, being sedentary, sitting too much, a variety of things increase the risk of having coronary disease, but certainly cigarette smoking is the most dramatic.
He looked great on the outside, and a lot of us go in for that annual physical, and we get the EKG, which gives an electrical report on the heart. Would it have uncovered things like artery blockage?
Unfortunately, probably not, unless he'd already suffered an injury from having a heart attack or a small heart attack. The problem is that the arteries are living pipes. They provide blood flow to the heart muscle, which needs to increase its blood flow to get oxygen and fuel when you exercise. And those pipes, they'll dilate and relax to get more blood when the heart starts to contract more. As the lining of those blood vessels fills up with cholesterol and plaque from having all those risk factors that we just talked about, it doesn't work very well, so it doesn't relax as well, and sometimes it can crack and split and a blood clot will form inside the heart artery, even for a brief period of time, and that causes a transient, a short-term cessation of blood flow and sort of a heart cramp, and then an electrical instability and sudden death. It's the most common cause of sudden death.
So what should people look out for?
Well, first they need to know what their cholesterol is, that's for sure. Can't change your parents, but know what your family history is so that your doctor can determine whether perhaps an earlier initiation of therapy is important. Smokers know they're not supposed to smoke.
Yeah, right.
There's no smoker that doesn't know that, but particularly if you have a strong family history, if your cholesterol is elevated, that provides even a more powerful impetus perhaps to stop.
Terrific advice. And you're going to be back in a couple of minutes. We're also going to talk about another issue on the other spectrum, the other young people, young athletes, and some new requirements for them coming up across the state of Texas that start very soon. So we'll talk with you about that in a couple of minutes.
Stick around. All right.
Welcome back. Parents and school athletes here in Texas face some new requirements to keep them safe on the court or on the field.
Cardiologist Benjamin Levine is back with us from UT Southwestern and joins us. So basically there's this new idea that there's going to be a UIL form that all parents are going to see, and this just basically has some questions to talk about maybe some kids' risk factors when it comes to having some sort of heart problem on the field.
Sure. Well, there are lots of reasons to get a kid in front of a doctor, but one of the main reasons for doing a pre-participation evaluation is to identify the risk factors for the most serious problem, which is sudden cardiac death. Perhaps the most important is having a family member who died early, under the age of 50, or someone who's still alive and who has had a serious cardiac problem younger than the age of 50. But other issues, particularly athletes who fainted during or after exercise, that's a real serious warning sign. The sudden onset of palpitations, rapid, regular heart beating that makes an athlete feel uncomfortable. The feeling of near faintness, like you're going to faint, the chest discomfort during exercise, shortness of breath out of proportion to what you felt before. These are the questions.
But you might see that during two-a-day practice in the Texas summer heat. You're going to see kids with a rapid heartbeat because they're a little bit dehydrated. You're going to see kids that may be exhibiting some of these symptoms. Should the coaches then pull them out of practice?
Well, that's a great question. There's a limited sensitivity to these questions. And the key, of course, is getting the kid to answer them correctly. Sometimes the kids will ignore it, or the parents will ignore it. And I think that's the most important point of this UIL form, is to make the parents and the families aware of what those warning signs are. So it's not just being short of breath or tired after 2-day practices. It's being more fatigued than you have been, more tired than the other kids, stopping earlier, being the last kid in, having palpitations that continue after you finish exercise or come on suddenly, or feeling like you're going to faint.
And the idea is that if the kids answer and say that yes, they've seen some symptoms, then extra tests can be done to see if they might be at more risk.
Exactly.
And then sometimes it still doesn't get caught, and a lot of doctors are now calling for like those AEDs to be on site at any type of athletic event, basically those defibrillators, where if something like this happens that is not caught beforehand,
Absolutely.
something
I
can be
think
done.
that's really important. So there's a limited ability for us to detect any disease by a screening program. So you have to have a plan. Every school has to have AEDs, know where they are, and have an action plan to know what to do with them in case an athlete or a spectator should go down.
You see somebody go down, and it may be a kid at football practice, it may be an adult in the shopping mall, somebody just drops to the ground. What should I do?
Right. If I can leave you with one critical message, it's call 911, go over to the person, establish that they're unconscious, and start chest compressions. Don't worry about breathing into their mouth. That kind of puts people off. Immediately start chest compressions, and as many people should be trained in doing that as possibly can be.
Go ahead and do it.
The chest compression is to keep the blood flowing to the brain.
Exactly.
Correct?
Keep the blood flowing to the brain while you're waiting for the EMS people to come or someone to come with the defibrillator. Getting that started instantaneously may be the difference between life and death.
Can I get in trouble for doing that if something bad happens?
No, you can't.
Good. Legally in Texas,
You
you're
can't.
protected.
Don't worry about it.
Great
Get going
advice.
quickly.
Thanks.
Nice to hear. You can find a link to the new sudden cardiac arrest awareness form. Also more details about checkups for kids on our website, myfoxdfw.com. We appreciate you being here.
My pleasure. Thank you.
Thanks.